Good evening, doctors. Welcome again. Today we are going to discuss about necrotizing fasciitis, a surgical emergency that is difficult to recognize in early stage. This is a surgical emergency which is difficult to recognize in early stage. There's two types, type 1 and type 2, which we define on the basis of their causative organism. Type 1 includes the caused by mixed aerobes and anaerobes, occurs post surgery in diabetic patient. Necrotizing fasciitis in type 1 occurs in a diabetic patient that causes by aerobes and anaerobes together, and type 2 caused by a group A beta hemolytic streptococcus pyogenes, caused by group A beta hemolyticus streptococcus pyogenes. Okay. Now, features includes mainly its acute onset, painful erythematous lesions develops. Here the painful erythematous lesions develops here. Extremely tender over infected tissue. This is extremely tender over the infected tissue. Okay. Management by urgent surgical debridement. Management is mainly by urgent surgical debridement, and IV antibiotics, clindamycin and benzyl penicillin is used. IV antibiotics like clindamycin and benzyl penicillin is used. So guys, I hope till here it's very much clear for you. If you have any queries, any question, you can ask me, and if you're new on my channel, please subscribe it. Thank you, good day, goodbye. That's all for today.